Hello, everyone, and welcome to my presentation on emotional and mental abuse of children and how it affects them later in life. My name is Lauren Lieb, and that's what we're going to be talking about today. Children can be abused in different ways. These ways can both be emotionally and mental abuse. These symptoms are different and harder to figure out because a person may not see these as easily or as readily as children with physical abuse. Along with this, the abuse that can change in different ways as the child grows older. Signs that a child might be emotionally abused include seeming unconfident or lack of self-assurance, struggle to control their emotions, have difficulty making or maintaining relationships. For younger children, these can usually mean long-lasting friendships, or for older people, that can mean relationships such as datings, things like that. Along with this, children can act in a way that's inappropriate for their age. So that means they can talk about things that usually children would not talk about, sort of like sex, or they can talk about things they saw on TV, or because they've been neglected, they can also talk about things like bills and financial stability. So these are things that children would not normally be talking about, but because they've been left alone, this is what they end up talking about. Children who have been abused emotionally can be broken down into stages of life. This would be the toddler to preschool stage, and then older children after that. This abuse or neglect can lead to certain problems down the road, like behavior problems, emotional problems, and mental health problems. The signs of emotional abuse in toddlers would usually be them being very over affectionate, or them being not aware of strangers, um, and they might go up to people that they know but not very well, and they may cling on to this person. They may be unconfident or anxious in their abilities. During preschool, we see where kids have to perform some task, and if they don't do them, they may feel let down or not be confident that they can do certain tasks. They may not have a close relationship with a certain parent. And they can also be aggressive or cruel towards other children or animals. This one is very important because children do want to get attention, so they might be cruel in order to get that attention. So it is a good idea to look out for why they are so cruel to one child, particularly, or multiple children. The signs in children who are older, these are usually using language that we don't think they would use, acting in a way that we don't feel like they should act in, struggling to control their emotions, having extreme outbursts, seeming isolated from their own parents, a lack of social skills, and having few to no friends. The few to no friends can be referred back to back when they were a toddler. They were aggressive and were not able to build meaningful relationships. Along with that, some of them may just lack the social skills necessary in order to make emotional connections and friendships. Um, Many of them may use language that we don't consider appropriate for a teen to use, or they may act in a way that we don't think is appropriate for them. It could be that we may feel like they are too grown for their age, so they use more grown language, or they may slip backward and try to act more like a child. Children who have been emotionally abused or neglected as they get older will usually spend more time by themselves unsupervised. So many of them can get into things that we would usually see as made for older people. Along with that, many children who might be suffering from it might have a hard time controlling their emotional outbursts. This could be if we mention that something might be wrong, they could end up seeing it as a bad thing and start spiraling because they don't know how certain people are going to react in their lives. The effects of the abuse can be categorized into three different areas, as we talked before: behavior, emotional development, and mental health problems. When looking at the behavioral problem side of it, we can see that this could be wanting attention more, becoming more clingy, not caring about certain consequences. Another one is making people intentionally dislike them so that way they can't form these relationships. Along with that, they might develop certain risk-taking behaviors like stealing and running away to make themselves look like bad or problem children. When talking about the emotional development of it, they can have a hard time talking about their emotions, and along with this, they can have confidence issues and anger problems. Another one is the fact that because they will have a hard time making meaningful and healthy relationships later in life, this will be hard for them to make any strive towards getting better or have a chance to even trust people. Many of these children will end up having problems with mental health also, like depression, anxiety, suicidal thoughts. They can also end up with eating disorders along with self-harm. Because of the lack of closeness, some could end up having a language development as well, because we learn best our language through talking. If no one's talking to us, we cannot learn. And one of the last things that might happen is this will affect how they see relationships in the future. They may see it as a bad thing and something that should be avoided at all costs. The effects of emotional abuse in relationships can have people develop attachment disorders. As they get older, if they were not diagnosed before when they were younger, many of them will never receive an actual diagnosis because there is no formal one for adults. The one adults might get diagnosed with as a child is DSED. This would be disinhibited social engagement disorder. People might develop this due to the response to social neglect and lack of consistent attachment to a primary caregiver, who would be the primary role of caring for the first 2 years of their life. People who might also have this might also have symptoms of hyperactivity, minimal social boundaries, sociability issues, and most of them will approach and engage with strangers regularly without boundaries. When the child grows up into an adult, these symptoms can worsen because they don't know how to socially engage. So for them, a simple intrusive question may not seem harmless, but for a normal person who has had social engagement, these can be very personal and upsetting questions, which can cause them to not be able to form relationships because they may come off as clingy or creepy, which can make it hard for them to make relationships with other people. According to Fletcher and Sissons, a person who faces emotional abuse as a child or in a relationship may have difficulties in other relationships. People who have experienced abuse in childhood may develop an attachment disorder. This can help make it difficult for them to create positive social or romantic relationships later in life. As a counselor, we have to help children who are emotionally abused. Some of the ways we can do this is help the child build trust again in adults, um, help them create healthy boundaries and show them what a healthy relationship is. Another thing is help them boost their self-esteem and teach them how to use conflict resolution skills or conflict management skills. We can approach this in different ways. We have trauma-focused cognitive behavioral therapy. This helps children who have been abused look at better ways of managing their feelings. This therapy can involve an adult later on who the child trusts, such as another parent or someone else in the child's life who the child can talk to about what happened and why it happened. Another one we can look is child-parent psychotherapy. This treatment focuses on improving the parent relationship and building on a stronger attachment between the two. That is what the Mayo Foundation for Medication and Education Research says. While doing this therapy, the parent who may have caused the neglect might find out why they started in the first place. They can learn healthy parenting strategies and different ways to deal with the frustrations in life. By using these two, there's a good chance we will be able to do the 3 things that we talked about below. References. Thank you for listening. I hope you learned more about how we can work on making children who have been emotionally abused safer, and how we are able to notice the symptoms and how we are able to get them help. Have a good night.